Hello, my name's Sue Bracendale. I work for Vosca. I'm giving a video report on the Health and Wellbeing Board that was held on Thursday the 4th of September. I'm filling in for Peter Walker, our usual advocate on the board, who was on holiday. As usual for this meeting, a full agenda. We started off with a presentation by Nick Smith on the Joint Strategic Needs Assessment, was an update on the population profile of Bristol and what that might mean. Pretty useful information, no dramatic changes that I can see from previous years, but probably some stuff in the detail. Below this video you will find a link of all the various presentations, so if you're interested on the current news about the population profile, do have a look at that. Interestingly, after that agenda item, there was some discussion about the health inequalities in Bristol, which many of you may be aware shows a difference in lifespan between the most richest wards and the poorest wards in the city of something like 9 years, which is pretty scary. That's not really changed much over the years, and that is in line with national data, but it's still a concern. There was some debate led by councillors who attended the meeting about how the Health and Wellbeing Board, its strategy and its action plan could really make a difference to some of that stuff. So there was a fairly lively debate led by councillors on that, and as an upshot of that, the meeting but next, the action plan is coming back to the board for us to really have a look at where and how the Health and Wellbeing Board can make a difference in that really challenging agenda. So it's quite useful to get that on the table. The next item was a strategy priority for food, a really interesting presentation that shows some really excellent work being done across the city. Again, for those of you interested in the food agenda around Bristol, do have a look at the detail of the presentation. It shows Bristol's really taken the lead in creative thinking in bringing together issues around food and what is good food, and by that they do mean cheap food, fresh food, local food, so all sorts of things that would all support. It's quite an interesting piece of work and would be of relevance to anybody who's involved in food, particularly young people, and work within the schools, because it does impact obviously on obesity. Next agenda item was the Better Care Fund. Very short update from Jill Shepherd, who's the Chief Officer of Bristol Clinical Commissioning Group. The bid's very complicated, it's still on time, it's going in, good progress, some very stiff targets for them to meet, 3.5% reduction in hospital admissions over the duration of the Better Care Fund programme, so that's going to be quite a stiff target. Some good work between the Clinical Commissioning Group and Bristol City Council on that. The general feeling by John Reedman and Jill Shepherd was that we're probably a bit further ahead and doing a wee bit better than many other areas, but it's a tough challenge. So that was just a verbal update. The next item was presented by Judith Brown, who's the Operations Director of Bristol Clinical Commissioning Group, and that was on personal health budgets. Now, there's very few people at the moment who are getting personal health budgets, but that's likely to change. The government want to see more of it. It's quite a complicated, albeit interesting piece of work if you are involved in the field of personal budgets and continuing health. I urge anybody who's working in that field to have a look at this very good summary of what this very complex and detailed piece of work is all about. It's an excellent summary of some of the challenges and where we're at on personal health budgets. So I'll probably do a news item out to the sector, but if you are in health and social care and working with people, do take time out to have a look at that one. It's a very good summary, as I say. The final item on the agenda was again from the Clinical Commissioning Group. Jill Shepherd presented the fact that the Clinical Commissioning Group need to do a yearly look at commissioning intentions and really asked the board for their thoughts about how they could do this and what the challenges were. At this point I chipped in and reflected that looking at the work last year, many people find it quite difficult to understand the language and the context of a one-year commissioning plan for the Clinical Commissioning Group, when we all know much of the commissioning is over a 5 or 7 year cycle. There's lots of other strategic documents, and urge them to go back and think about how they can put this 1 year commissioning intentions into a broader context so it's more understandable for people. Any of you who might have had a look at last year or been involved with anything to do with the strategic planning of the clinical commissioning group will understand how complex it can be. Whilst it's a challenge, I do think that they can make it easier for people to understand by broadening out all the strategic thinking. So I've been asked to meet with Piers Glenn from the Clinical Commissioning Group, he's the lead on this, to see how we can make it more understandable, more relevant. So that's a piece of work we'll be taking forward, and hopefully that will result in some better communication to the voluntary community sector about the strategic thinking of the Clinical Commissioning Group. Good meeting, nice to see the co-chairing with Dr. Martin Jones and our Mayor George Ferguson working well. Martin Jones took the lead this time, they both clearly worked together well, and I think that's brought a good dynamic to the meeting. Very pleased to see our councillors on the group who do add a good touchstone of challenging and questioning council officers to senior levels. So I think the makeup of the meeting's working well. The next meeting is on the 16th of October. I haven't seen the agenda yet. We will get out to the sector if there's time with the agenda items, if there's any feedback. Please get in touch with me if there are any items you want to take forward on the Health and Wellbeing Board. If we can get them in on the agenda or they fit in with agenda items, we will do our best to do that. Thank you very much.